Hi everyone, I welcome you to the 12th episode of Let's Talk Health. Today we have Dr. Deepak Sharma sir here, a senior consultant and surgical gastroenterologist and laparoscopic surgeon at Citizen Specialty Hospital. Good afternoon, sir.
Good afternoon.
In this modern era of fast-paced life and changing food habits, how does the change in food habits and unhealthy lifestyle going to affect anorectal problems? We are going to discuss it today with Dr. Deepak Sharma sir. We are going to discuss with Sir now. Sir, what are some of the commonly seen anorectal problems?
As you have rightly put in, that the fast-paced life is bringing about lot of changes in our food habits and our living pattern. We are going in for more of junk food and avoiding vegetables. At the same time, there is a lot of stress in life and improper food intake, improper timings, irregular sleep. All these things are leading to many anorectal problems like piles, which is also known as hemorrhoids, and fissure. These two, though they are separate, but the causative factors are similar.
What are the symptoms or any indicators to suspect this kind of anorectal problems?
The people will generally come with complaints of painless bleeding while passing motion, or sometimes it can be painful bleeding. The patients can have constipation. They can also have what is called as tenesmus, lot of pain while passing motion. Some patients who have infection and develop abscess, they can even have fever.
What are the risk factors or any associated factors that which lead to this kind of anorectal problems?
Risk factors actually, as already pointed out, improper food habits where we are taking in less of fiber and eating more of junk food where there is no fiber. For example, non-vegetarian food, like a few days back we had a survey which has reported that there is 97% of people are eating non-vegetarian food, which only means that the vegetarian diet is coming down. So I would like to advise people to take more of vegetables, more of fruits, and a lot of liquids to drink.
So when should we consider medical help?
Any patient who is having bleeding, even if it is once per rectum, I think he should approach the doctor, or even if he is having some swelling which is coming out of the anal canal, there is no bleeding, but still, or is having pain while passing motion, they should report to the doctor.
Okay, sir. Sir, what are the lifestyle modifications that you suggest for the patients who are already suffering with this problem?
As I have already pointed out, that the patients need to have a proper timing for having food. They should fix the times. They are going to have a breakfast at 8 o'clock, lunch at 1 o'clock, and then dinner at 7 to 8. The gap should be, it should be properly spaced, and at the same time, they should eat a lot of vegetables which have fiber. They can even go browse and see what all vegetables have fiber, and fruits. For example, cucumber, radish, lady's finger, gourds, let it be bottle gourd, snake gourd, or bitter gourd. Then they can have green leafy vegetables. Amongst fruits, papaya, fig, guava, then pomegranate. These are all known to have a lot of fiber in that. So at the same time, I would advise that the patient should take fruits, not fruit juices, because if you take juice, they are going to filter it, and then they will not get any fiber content from it. The important takeaway point here is to have a lot of fiber in the diet along with liquids.
So what are the treatment options available for fissure or filings?
The treatment options, actually, both, whether it is piles or fissure, they are mostly recurrent problems. For them to be under control, we need to change our lifestyle, our eating habits to this, as I said, high fiber diet. And there are some certain points which they should follow religiously, like they should sleep at a proper time, get up early in the morning and try to pass the stool as early as possible in the morning. If they delay, the stools get drier as the day passes on, and then they will pass hard stools. Once the stool gets drier, they pass hard stools, and these hard stools can, because of the increased intrarectal pressure, cause either hemorrhoids or tear the anal canal, resulting into fissure. This is the lifestyle modification as far as the piles or fissure is concerned. Whereas treatment, medical line of treatment like surgery is not indicated for all the cases. It is meant only for third or fourth degree of piles or severe cases of acute anal fissure. Otherwise, these conservative measures and stool softeners along with SIDS bath will suffice to deal with this problem.
Sir, what are the surgical options available for treatment of hemorrhoids?
As far as surgical treatment for hemorrhoids is concerned, grade 1 and 2, we do not operate. What we do is band ligation or sclerotherapy. For grade 3 and 4, we can do laser therapy or surgical excision of the hemorrhoids.
So, what are the benefits of laser therapy over open procedure?
In laser therapy, we do not have to use a surgical knife, which means there will be less of blood loss, there will be no wound, and early discharge from the hospital, less post-operative pain, and patient will be far more comfortable than surgical excision.
So, what are the chances of recurrences of these anorectal problems?
As I said, we can prevent or control these problems. As such, there is no cure. All of them, even after surgery, there is a chance that over a period of time, unless the patient doesn't follow the routine which we prescribe regarding high fiber diet and regular timings and passing motions early in the morning, they are bound to recur over a period of time. A take-home message from this is to have a healthy lifestyle, eat high fiber diet, take lot of liquids, and have a good sleep, and have a healthy pattern of passing motion as well.
Thank you so much, sir, for your valuable inputs.
I should thank Dr. Shruti that you have brought up this topic, because it's a very much prevalent issue which is going on in the general population. Now we are seeing almost a rise of more than 50 to 60% of anorectal problems, and I am sure these inputs will help the people to manage themselves in a better way and lead a healthy life.
Thank you, everyone. We'll meet in the next episode of Let's Talk Health.